This is a basic surgical set. It's a small representation of the tools that a surgeon would use in a forward surgical setting, such as a forward area surgical team. Moving on to the right, this is some more of the same type of equipment. Basically just a real generic surgery set that you can use in just about everybody. These packages here are pre-packaged modalities for different types of things. Arthroscopy, that's really not appropriate for this. We're not going to be doing scopes. These are central lines, the central line set, to get a lot of fluids into a large vein for fluid resuscitation for patients. You know, your standard gloves, gowns, bowls. This is a Broslow-Hinkle system. It's a pediatric set. It's color-coded, and the colors are based on the size of the child. You put a color-coded tape on the table, lay the child next to the tape, and then you can see what color it is that coincides with the size of the child. Grab that set, and everything is size appropriate for that size child. Over here on this wall, these are just general prepackaged sets of the things that you would use on any number of patients: tape, dressings, some airway stuff, syringes, just the general generic medical equipment that most people would have. And of course, you have your field sink here, so you always want to have your people washing hands. You can actually, it's a headlamp. You can put this on your head and get a lot of light on one little area, and that sometimes is important, especially when you're doing an actual surgery on somebody. And you can also use that on battery backup in case the generator goes out or something like that. Once again, over here we have the same kind of set. Different things on the inside. It's a hypothermia blanket. Basically, this blanket gets warm just like the little hand warmers you put in your pocket in the wintertime, and it'll stop hypothermia from happening in the patient. And just general airway oxygen masks, that kind of thing. Over here on this side is the anesthesia set. Just a scaled down model of what you're going to get in any kind of major hospital. We have nurse anesthetists that work in this environment, and this is, their whole life revolves around this equipment and taking care of patients with that, breathing for them, and the appropriate gases and anesthesia medicines that will keep somebody unconscious in a surgery. Over here we have a respirator. Couple different kinds of respirators. This is more of a field type unit respirator, and that's more of a hospital type respirator. Both of them will do about the same thing, and this one also has a lot more of the patient monitoring stuff that goes along with it. This one is just plain respirator. Over here is a monitor system. It says equipment alert right now because it's not really attached to a real person. It's an actual monitor that we use. Monitors blood pressure, respirations, temperature, pulse, mean arterial pressure, oxygen saturation. And then over here is for a chest tube. If you have a chest tube and somebody evacuating fluid or air out of their chest, you're going to attach it to that, the PureVac unit, and that will keep air from going back into their chest when they actually have a tube in there. And you can see our basic patient here, endotracheal tubes for intubation if somebody needs a patent airway and they're unconscious or has a surgery pending or actually going on. We'll have one of these tubes. This is a bag valve mask, and you're going to hook this to a tube if it's in the patient and breathe for the patient. Or there's a mask also that attaches to this that you can hook up to the patient with this. If they're not intubated, you can breathe for the patient that way. It's a good measured amount of air that the patient's going to get. The basic operating set is you're going to have the lights right here that you can point right down to what you're working on. They're small, they're compact, they're light, they're easy to set up. And the whole thing goes together in about an hour with a crew of about 20 people in a tent that's about 2.5 times this size.